A circuit breaker is now required to break the chains of transmission in our province and allow us to safely move forward through this next phase. Gathering indoors is what is the greatest risk to all of us right now. As a result, for the next 3 weeks, from midnight tonight through to April 19th, I am putting a number of amendments in place.
These changes starting at midnight tonight are to try and curb the increase in cases of COVID and variants in the province. They include dine-in service prohibited except outdoor patios, bars and pubs without full meal service closed, Whistler Blackcomb Ski Resort closed, limited indoor religious services canceled, indoor adult fitness classes canceled. These are the places where Henry says the transmissions are being amplified. How bad is it right now?
During the past week, case counts have risen unacceptably high. In fact, higher today than at the worst point of the second wave between November and January of this year. The percentages of tests coming back positive has gone up by 50% in some areas, and the number of variants in British Columbia has also increased.
More than 2,500 new COVID cases over the weekend, and more of the variants that are more transmissible. Now, 413 active cases, nearly twice what there were in BC 4 days ago.
It is important for us to take measures now to stop the transmission of these important variants in our communities as our vaccination program is ramping up. We are concerned that these are driving much of our current transmission.
Those transmissions have led to more cases in children while students have been out of school for spring break. But now classes are back. The province strongly suggesting all students grade 4 and up wear masks, mandating it in hard-hit Surrey.
Teachers have been calling for these measures to be put in place for months. That has been very stressful. The exposure notifications, especially in the areas where we're seeing them repeatedly, have been very stressful. Teachers have had to take on the load of keeping students safe and keeping each other safe, and that has been very taxing. So we welcome the additional support of the mask mandate, and we also see that there are other measures that need to be put in place as well.
Teachers are continuing to push for more hybrid learning options, and as classes resume, a warning for people who chose to travel for fun over the break, especially as there have been a cluster of one of the concerning P1 variants in Whistler.
It is critical right now that if you or anyone in your family develops any sign of illness, that you, especially children returning from spring break, and if you have traveled, you must stay home from work or school. Arrange to get tested immediately.
Travel continues to be a no-go unless essential. People also asked to work from home if possible. Today, also a pause on AstraZeneca vaccine here and across the country. This while more study is done on the risk of blood clots, a few dozen instances outside of Canada.
The instances are rare. This is a very rare condition with tens of millions of doses of this vaccine being used. We are taking the precaution of suspending the use of this vaccine for people who are under age 55 for the next few days.
Those who've had AstraZeneca should watch for symptoms and get medical help if concerned. But BC's age-based vaccination rollout not affected. And as the process continues, public health and the province imploring people to follow restrictions, especially those in their 20s and 30s, where most transmissions are happening.
Do not blow this for the rest of us. Do not blow this for your parents and your neighbors and others who have been working really, really hard, making significant sacrifices.
For City News in Victoria, I'm News 1130's Liza Yuzda.